You mentioned the statement where the media, Hollywood, and the ultra-left of Hollywood now controls the White House.
Yeah. After January 20th, whether the new president understands it or not, there's a price to be paid. And he will be enthralled to them, no matter how independent he may feel. That simply isn't the way the system works.
Let me ask you about this concept of Foca, Freedom of Choice Act, and it's something that all pro-lifers have feared as their worst nightmare.
Well,
why
all
is that?
pro-lifers have to understand this is the ultimate construction and drafting of all of the pro-abortion forces, whether it's the independent clinics, Planned Parenthood, the population control movement, and its coalition organizations. This is the ultimate of their drafting. There were two other versions of the Freedom of Choice Act, Foca. Each one has become more expansive than the one before it. But in this final version, which is what the leaks are suggesting, that the incoming president will create by executive order, it embodies everything that they would like to accomplish in stripping away the power of the state at any level to control abortion, to strip away from us at any level the power as the people to defend against it, and the power at any level even to protect parental rights or conscience rights not to participate in it.
During the election, there was a lot of talk about his his going against a bill in the Illinois legislature that basically said, if you're born alive, you're safe. In other words, if you're born alive and some nurse grabs you and takes you to the intensive care, then you escaped the abortionists. But here's a couple of statements that he made concerning this that are revealing. It says, in terms of aborting babies and letting them die, it is a doctor's perspective. He's quoted as saying, because this bill would have taken away from doctors their professional judgment when a fetus is viable.
Yeah, that is an unfortunate remark, and I'm hoping the passage of time has improved his perception somewhat. A doctor's judgment is not what determines when a baby is or is not viable. The U.S. Supreme Court, in the 1973 decision Roe versus Wade, laid out what they thought should be included as viability, which is the capability of surviving outside the womb, albeit with artificial means. That's all viability means in those terms. But we're talking about a baby in a late abortion, which unless some effort is made to kill the baby during the procedure, will always be born alive. So that where there was a nurse who had the courage to do so, they would usually grab that baby and rush to the premature intensive care nursery. And that baby, if it survived, would simply be taken out of the abortion figures and treated as a live birth or premature birth, whichever had to be recorded. However, in this defeat of the bill that would have protected that infant that was born alive, it means that someone could just leave that living, very premature baby in a basin in an abandoned room or hallway and just let it die. And that was the usual fate of such babies unless there was such a determined and courageous nurse around.
So, for instance, in Rhode Island, we do have a law that says if a baby survives abortion and it is alive, it subsequently cannot be killed.
It's good, but unfortunate that you have to have it, you'd think.
It would be
that
natural.
Just the fact that one had escaped the womb, one would have escaped Roe versus Wade and Doe versus Bolton, which in fact is true, except some misguided doctors actually have felt they had a right to pursue the child that escaped dying in the abortion procedure. But in point of fact, that is not the case. The doctor has the final decision with regard to doing the procedure right up to the last minute, the last month of a full-term pregnancy, if that state has not made laws relating to a woman's health, so that the state can make some regulations, even to the point of prohibiting it in the last 3 months of pregnancy, but no state may make a law that would overrule the doctor's medical judgment. This is not a case of medical judgment. If the baby is alive, he's going to cry, and everybody will hear the cry, and people who are in the room who have no medical training at all will know that that baby is alive.
I find this phrase, in terms of his mind frame, because he's so articulate and chooses his words so well. This bill would have taken away from doctors their professional judgment when the fetus is viable, when the fetus has escaped their attempts to kill it, and
well,
it's now
that's
outside.
Pure abortion propaganda speak. Certain amount of the discussion simply uses catchphrases and answers that have been crafted by those who are creating answers for candidates or political figures to use. The same is true for something he sometimes used, which Clinton also used, that of course he would not oppose those procedures which would protect the life and health of the mother. Partial birth abortion, the so-called dilatation and extraction abortion, has nothing that can protect the life and health of a mother, because you have to take a normal delivery with the baby proceeding head down in its normal fashion, turn it around to make it breech, then pull the feet down, making it footling, which is one of the most complicated and dangerous forms of delivery. Then you have to pull the body down until only the head is still left inside. Then using scissors, Metzenbaum scissors, that the operator inserts over the 2 fingers that he has to guide them through the hole in the back of the skull called the foramen magnum and penetrate the lining of the brain. When that opening is made, then a large instrument called a trocar, through which you can suction out the baby's brains. And the only reason for that operation is to make sure that the late abortion ends with a dead baby. But some of the doctors who've gone to trial in complications of late abortion cases have been defended by legal counsel who've tried to suggest that the abortion decisions made it necessary for the doctor to guarantee that the woman left with empty arms.
Another statement, wanting to stop live aborted babies from being shelved to die was all about politics.
Well, that's wrong. There's something called simple humanity, simple concern for the unborn child who cannot protect himself or herself, something about looking at the youngest member of the family in danger and wanting to do whatever one can to protect that little one from danger, who can't run away, can't riot in the streets, and cannot vote.